Good morning, good afternoon, and good evening, everyone. Thank you for joining us again today. We are going to talk about a next best practice, a good clinical workflow. It's actually the second in our series of population health solution workflows. So this one, as you can see, is called Gaps in Care at the Point of Care. And your presentation team today is myself, Dr. Jen Bolduc, Vice President of Population Health, pediatrician and clinical informaticist, and Brian Sowers, who is a Senior Product Manager in Population Health as well. So the best practice that we have set up for you today, as I said, is gaps in care at the point of care. And this is particularly important because it really engages physicians in population health information. What we intended to do was deliver the gaps in care right within the EHR. So as a physician is seeing a patient, that information is available to them without having to go somewhere else and look for it. So with that, Brian, let's take it away.
Thanks, Dr. Jen. Let me go ahead and jump into the NextGen EHR. So pretend for a minute that I'm a nurse, a care manager, or a physician, and I can access the patient's chart in many different ways. I can access it from my schedule, or I can just quickly come here and search and find a patient. So let me go ahead and bring up a patient, Emily, here. And you're so used to working with our EHR, you can see the patient's information on the info bar at the top of the screen. You can see the encounter history on the right-hand side of your screen. But there's something a little bit new here. We call this as our insights ribbon, where you probably just noticed that I just pulled down information and gave us insights into this patient. So I can quickly come over here and I can expand this out and I can see information that pulling from our population health solution. We can see gaps that are passed for this patient, the ones that are near due, the ones that are failed, or excuse me, the ones that are past due, excuse me, and the ones that are failed. And also we can see risk scores from here. We can see the patient's HCC, ASCVD, and ACG rub scores from here. So we can quickly get that information before we start treating the patient. If we need more detailed information, we can easily reach up to our population health solution by clicking on the link here. What this will do is reach the patient's profile. And again, I can quickly see the gaps in care from here. I can also drill down and get more risk information for this patient, so I can get more detailed information on the patient's risk before I treat the patient.
And Brian, just a couple things to add to that. One is that this solution can be used with any EHR. We've shown it with NextGen Enterprise, but it really can work with any EHR, right?
Yeah, exactly.
Yeah. And then some people might be wondering, why would we want to launch into the patient profile within population health? And that's really because population health can have multi-source data, right? This might give you information that you don't have in your EHR, something from claims or something else that you may want to see. And then lastly, since the clinician is looking at this while they're seeing a patient, or they've got the patient in context, they could also share this with the patient, right? And tell them how they're doing with closing their gaps in care, and maybe negotiate a little more authoritatively when they're trying to enlist the patient to get their gaps closed. So just a powerful educational tool as well, right?
Exactly.
It's great stuff. So for this best practice, what we really wanted to show you was the ability just to see those gaps in care right in the clinician's workflow. And as Brian pointed out, whether they're a physician, a nurse, anybody who is in the EHR will have access to this information and can act on it. The important point is that you don't have to log in to a different site and then search for the patient and then find the gaps in care or the risk stratification information. It's all right there for you. So that's the best practice we have here. And it's less than a minute to access that. It's a few seconds in your day. And that is the end of our second in our series of best practice workflows for population health.